As far as how is dermatomyositis treated? Well, just like a lot of things in rheumatology, the patient is put on steroids to calm that reaction down, and then they are given a steroid sparing agent, so a medicine that will do the job of the steroids but without the steroid problems. And in this disease, because of that photosensitive skin stuff, it's important to avoid sun exposure. And then also physical therapy, once the muscles have calmed down a little bit and the patient is in less pain from the muscle weakness and having have more ability to take part in physical therapy, then that can be prescribed. Finally, how well do these patients do long term? Well, in dermatomyositis, the prognosis is actually pretty good. Once the patient is treated, they do very well. And in fact, some patients, the disease actually completely goes away. But in these patients, that perineoplastic part, that part where you have to kind of aggressively look for any cancer, is very important. So this is the case where the patient has to be asked, what kind of work are they in? What kind of environmental exposures do they have? What kind of habits do they have, like smoking or something that would put them at increased risk for cancer? What runs in their family? Like maybe there is a certain type of cancer that's very unique in this patient's family. And then finally, maybe it was a hard year and the patient wasn't able to go for their routine cancer screenings or their routine checkups to their doctor. And to me, this is probably one of the most interesting parts of medicine, because I feel when you get to know people more, you begin to understand them better, and then you begin to care more about their well-being.